Measuring the vertical dimension of occlusion and centric relation. Taking bite registration. Recording vertical dimension of occlusion is easy utilizing our customized DENTCA tray. To assemble the built-in intraoral Gothic arch tracer, first insert the center pin holder into the mandibular tray. The bevel should go downwards and you should hear clicking once you insert it. Now, gently screw in the plastic center pin. Make sure the pointed part is aiming upwards. It is always best to set the center pin to the highest point before measuring the vertical dimension of occlusion. Make sure the posterior parts are detached. After inserting both the maxillary anterior portion of the tray and the mandibular anterior portion of the tray in a patient's mouth, simply rotate the threaded pin clockwise until the patient's lips naturally touch each other without any force. Check to see that the lips do not have any tension and the patient is not forcing their lips to close. If the patient has an existing denture, you can use the existing vertical dimension of occlusion by adjusting the center pin to match the predetermined vertical dimension. If necessary, you may cut the center pin in half to shorten the pin. After cutting the pin in half, you can smooth out the protruding pin thread with a slow-speed handpiece for the patient's comfort before taking the centric relation record. Once you have determined the patient's vertical dimension of occlusion, you will be able to identify the centric relation position by conducting a simple jaw movement. Have the patient move their jaw forward and back several times to identify the most posterior position. Once you have identified the most posterior position, inject the bite registration material in between the arch. This is the patient's centric relation location. After the bite registration material is set, remove the entire piece from a patient's mouth. Send these impressions as attached right after removing the entire piece from a patient's mouth without detaching any parts.